He talks about recovery, talks about his family, talks about himself, he talks about other people. It's like a different person, and that's about the time when I started to really feel hopeful that my son is on the right journey.
I'm just very grateful to hear this story here because about 15 years ago, I used to go and talk to people about cannabis-induced psychosis and try to tell people, hey, this is a real thing, this is a real thing. And I think a lot of people just didn't believe me. And some people just flat out laughed at me. And I think it's crucial to hear stories like Brandon's and his family's story because it's a classic textbook case of cannabis-induced psychosis. A young man accesses marijuana and thinks that it's not such a big deal. You know, even his parents maybe initially didn't understand that it was a big deal and the long-term consequences that this could have. And then it just progressed, things just progressed slowly from there. It can start with some kind of magical thinking or strange type of thinking, and then it can progress from there to paranoia, where people are afraid that people might be after them or out to get them. And then it can present then as just really obvious psychosis, which is a break with reality, like hearing things that aren't there, seeing things that aren't there. And it can look a lot like schizophrenia. And one of the really tricky things about psychosis is that people don't always recognize they're in psychosis and they don't know that it's necessarily a problem and I need to get help for it. So that's one of the reasons it's rather complex. So this connection between marijuana use and psychosis started at least in the late 1980s when there was a study of Swedish soldiers showing that those who had used marijuana as teenagers and young adults had about a 4-fold increased risk of developing schizophrenia as adults. And then since then, there have been multiple studies that follow thousands of people over decades of time with the same finding that marijuana use in adolescence is associated with psychosis and schizophrenia later on in life. And this is controlling for other substance use and family history of schizophrenia. And I think a really important point that's just come out recently is that there used to be the thinking that marijuana just brought out psychosis in people who were going to have it anyway. But now we're thinking that marijuana is a risk factor even in the absence of genetic risk for psychosis.